right, is I look at the arm and I kind of get an idea where the vein might be. So if you can see here in the middle, there's a slight little bump right here in the center. And if you feel, you can kind of feel a little bounce back. That's how you know that's a vein. Now be really gentle when you're feeling for veins. I've seen people that they try to be like, they try to do that, like very aggressive. You're not gonna feel anything. So just be really gentle, just kind of roll it, and you kind of get an idea before I even put the tourniquet.
It's like spongy.
Yep, exactly.
Just sort of bounce on it.
Then I'll put my little squeeze ball in her arm, and I told her just hold it for now, okay? Then I get everything ready. Remember what I said about having everything ready, so I even will put gauze on the shoulder so it's easy to reach in case an accident happens, needle comes out, my gauze is easy to reach. I'm not reaching over the counter or something. Another thing that you want to be aware of, especially in dental offices, is when you go to a lab and get blood drawn, they have a phlebotomy chair where your arms are naturally like this. Now, we don't have that in the offices, so we have to support the arm. The way we do that, you can get a pillow or something to keep the arm steady. If not, the patients are gonna bend the elbow and you're not gonna find the veins. So because we don't have that, go ahead and make a fist. Yep, put it underneath the arm. Perfect, just like that, okay? She supports her arm, it's nice and straight. So then, now I get everything ready, right? I give her the squeeze ball. I kind of have an idea where I'm gonna go. I take my Band-Aid. Little habit I have is I like to open it up and just kind of stick it to my glove like that, so I'm ready to go. Get my gauze. And the
It's right here.
Okay. Now we're gonna be drawing 6 tooths. Remember, we're gonna draw the blue ones first because those will keep the area, the blood liquid for longer. So now is that I go ahead and put my tourniquet on. Okay. Remember, logo facing out. We put it 3 fingers above the area where I'm gonna draw. So if this is the vein I'm drawing, from there, I measure 3 fingers. That's where your tourniquet should be. I don't wanna see tourniquets all the way up here or like right on the area where you're gonna draw. 3 fingers above the area. Now to tighten this, you wanna hold the buckle, pull it away from the skin so you don't pinch it, and really tighten, like really crank it. Is that really tight? Not bad?
Yeah, it's good.
Now see where I kept the buckle? If an accident happens, my needle comes out, I can easily reach over and press that button. If I hide it underneath and she pulls her arm back because she's bleeding, and now I can't find it. So now I'm struggling, right? So you always want to have it easy to view. Go ahead and pump about 10 times. Now look at the vein. When you have them pumped 10 times, it's adding more pressure. So those veins are going to be even more visible. Anything you need to do to make it easier. Then at this point, we grab our gauze. We're gonna disinfect the arm, okay? Go ahead and disinfect. We wait 30 seconds, let the alcohol completely dry. If you don't, it's gonna sting when we go in the arm. Now, you see how I always kept the little sheath on the vein here, on the needle? You wanna do that. If you take this off and I set it on the counter, you gotta throw that away. Because it's the risk of bacteria contamination. I'm going into her bloodstream, I do not wanna do that. And we take this. Okay, I'll put it over the vein. Now we have a visual. Now my job just gotten 10 times easier because now I can see it, okay? Now what I do, my technique is I take my index, I push down, you feel the pressure? Then I take my thumb and I pull the skin back. Look where I leave my thumb. It's right at the entrance of where the vein light is, okay? Can you pull that for me? The reason why, my thumb will help me keep that angle, okay? Grab my butterfly by the wings like this so I have an easy view of the end of it. I'm gonna go about a 15-degree angle. I'm gonna position myself on the path of that vein. And I count to 3, here we go. 1, 2, 3. You see the vein, the blood? And there you go. Now look what I did. I was holding both wings before I went in. As soon as I was in the vein, I let go of one of them. The reason why, my job now is to stay still. Lauren's job is just to fill the tubes. But if I move, because it becomes very easy to move, I'm gonna lose the flow. And then I'm trying to find the flow again and I'm wasting time. So to prevent me from moving, I minimize the contact with the needle. The less contact I have with that butterfly, the less chances of me moving in. That's why I only hold one of the wings, and I just kind of rest it up against the entrance of the vein light, and I just stay still just like this till we fill all of them. Okay? Look how fast the flow is going. One of the biggest ways you want to go by when filling a tube is the flow of the blood. Look how fast it fills. As soon as you see it that slow down, that's when you know it's full. Change it right up. That will even save you a few seconds in your blood draws.
So you already used a bigger cap for the red ones. So you use that for the blue as well.
Yeah.
Okay.
It's okay to use the blues on the large ones.
Yeah, okay.
You do not want to use the reds on the medium ones. Okay, and she drew the blue ones first. Give us a little more time. The centrifuge is over there. It's open. So when she's done, she's just going to pick up the tubes, go to the centrifuge, and finish up with the patient. Okay, now before you finish up, first thing you do, I pull my hand from underneath the needle. I support the needle. I pull the vein light off. That moving. Pull the tourniquet off.
Sorry.
Press the button, goes away. Grab your gauze. This has to be a swift motion. You never want to push while the needle's still in the arm. That's the worst way, the worst thing to do to your patients, because you're really going to hurt them. So pull the needle out all the way and hold pressure. Don't bend your arm. Now look, I don't let them bend the arm, because the whole purpose of me doing this is to hold pressure in the opening where I just went into that vein. If I have them bend the arm, I won't longer have any access to that vein. You can test it on yourselves. Feel for a vein, bend the elbow, and see if you can still feel that vein. You won't be able to.
Like if you need to go back in again, you mean?
No, after you're done.
Right.
You do not want to have them bend the elbow. You know how that's like an old technique that put gauze and they do this? That's not putting any pressure on the vein opening.
Oh, just moving it. That's what you mean.
It's gonna actually move it out of the way.
It's
If
so
I
big.
have clear access when her arm's nice and straight, why would I have them bend? You know? So what I do is I hold it for about 15 seconds, right? At least 15 seconds. I usually say by you, the phlebotomist, and not the patient, because if I tell her, maybe she'll do a good job, but most of the patients, you tell them to hold pressure, all they do is hold the gauze on top. They don't put pressure. So after 15 seconds, I take off the gauze and I look at the site. If I don't see any bleeding, then I put my Band-Aid. If I see bleeding, I hold the gauze for a little bit longer. The Band-Aid is not gonna put any pressure. All it is a psychological thing, okay? It's not gonna put pressure, it's not gonna help with the bleeding, so I wanna make sure that that stops.